Hello and welcome. You're here for a cranial nerve exam? Yeah? Okay, awesome. You can go ahead and take a seat over there. Just sit down for a minute. I'm gonna get some things, written down. Yeah, can you go ahead and tell me your age? Your name? Full name? Yeah, okay. Yeah, we have you in our system. Yeah, I'm gonna go ahead and get started if that's okay with you. Okay. So, a cranial nerve exam, it's not anything scary, I promise. I'm just going to be doing some, checking up, making sure that things are functioning properly, your eyesight, making sure your ears look good, make sure your pulse isn't too outrageous. Yeah, people, you'd be surprised at how many energy drinks they drink. And I try to tell as many people as I can, energy drinks are so bad for you. Yeah, they're terrible. Do you drink energy drinks or do you consume caffeine? Okay, have you drinking any today? Okay. See, you're gonna have to not do that. That's very bad for you, especially Red Bull. Red Bull's terrible for you. People need to just stop. It's a shame. It really is a shame. Okay, I'm gonna go ahead and get a light test started. So I'm gonna have you follow this light here. Ready? Okay, it's gonna be a little bright at first, but you'll get used to it. Okay, I just want you to follow it. Okay. I'll have you follow it again. Just follow it. Okay, good. I'm gonna go up and down. Follow it. Okay. Alright. Did everything feel good, smooth? Okay, now I want you to tell me, do you feel any strain? Follow the light again. Do you feel any strain when your eyes reach over here? A little? Okay. Let's try the other side. Just follow over here. Try there. And on that side. Okay. So there is a little bit of tension around the sides of your eyes. That's nothing too bad. It's just something you might need to, keep in mind. Try not to look too far to the side if that hurts. Just kind of be gentle on your eyes. Okay, we're gonna do another test. I'm gonna have you follow my finger. Follow them across. Follow. Okay, now I'm just gonna have you follow. Follow. Follow my fingers. Okay, good. We're gonna do another light test. For this one, I'm gonna have you close your eyes, and I want you to tell me how many times the light passes by. Okay? So keep that in count. Keep that in mind. And close your eyes. Okay. Okay, you can open them. How many times did you see the light pass by? 5? Good. Perfect. You passed the test. I'm just messing. This is not a super It's not a bad test. It's a good test. Everyone needs it. Alright. Actually, while I have this light out, I'm gonna go ahead and have you turn your face to the side so I can go ahead and check your ears. Just to make sure everything's good, there's not an excess buildup of wax. That can cause lots of problems. Trust me. Alright, turn your head. Just gonna look. Just gonna look. Just like give me a little. Just gonna look in your ear. Just like sit still. Sit very still. Just gonna look in your ear real quick. Okay. Now turn your face the other way, and you see your other ear. Okay, I will say you do have an excess buildup of earwax, but it is not too bad. I've had people come in with terrible wax buildup, and it is very bad. It causes pressure and tension in your head, and it's more likely to cause headaches. It can cause some problems. You're fine now. Nothing is too serious, but I would advise going to a specialist to get earwax removal. Some people try to do it with Q-tips by themselves at home, and it doesn't go well. Q-tips actually cause more backup in your ear. If you try to clean it out, it's just more likely to shove that earwax in there, Yeah. Unfortunately, but go ahead and, look for a specialist. I could recommend you some ear wax removal schedule. Like, I could definitely write you some up. Yes, okay. Alright, we're gonna move on to okay, I'm gonna go ahead and listen to your heartbeat, just kind of making sure everything's alright, everything's beating properly. I'm just gonna have you go ahead and sit up still. Alright, and I'm gonna need you to take a deep breath in and out. In and out. Take as deep as a breath as you can. Breathe in and out. Okay. I'm gonna have you turn around just slightly, just kind of, shift. I'm gonna do your back. Just gonna breathe in and out. Okay. Breathe in and out. Just one more time. And out. Okay, good. Okay, so everything sounded pretty good to me, except there is some, mucus buildup. I can kind of, hear it when you breathe in, just when you get to, a specific point, which there's nothing wrong with that. I will advise that you, try and maybe get some steam. I suggest working out. That can help clear mucus in your throat. If you smoke, that can cause mucus buildup. So, either lay low on that or try to counteract those with working out. Heavy exercise and cardio could actually really help with that. Running may be good. I know not a lot of people like running, but you can convince yourself to do anything if you try hard enough. Yeah, I used to hate running, and then I took up running, and now I like it. Which I never thought I'd ever like it. Ever. I also would recommend drinking tea, like elderberry tea. Elderberry is very great for your lungs and clearing out that mucus. You can get elderberry drops either at Walmart, Amazon, just anywhere, health food stores. Should really get those. Yeah, no, tea, running, maybe get a humidifier, put that in your room, maybe get that steam. There's saunas, steam rooms, hot tubs, just anything. And I can give you I can print out some papers for you, giving you like lists of ideas of like ways to kind of take care of that. It's not serious, but if it ever gets worse, which call me, let me know if it does get worse, I can prescribe you some medication. If you notice lots of coughing, I can prescribe you an inhaler, and I can give you another checkup. So just like let me know if things get bad with breathing like this. It's kind of tricky because it could be either really great or like really bad. You never know what it's gonna do. But for you, there's no worrying. But it's always just good to stay safe. Just keep that in mind. Alright. And I'm going to be checking your reflexes. So I'm going to have you sit down and relax your knees. I will be taking this and hitting the pressure point in your knee that causes that reflex to just go. I love it. I did that all the time as a kid. I'd take a hammer, whatever, and I'd just like always try and find that spot. Yeah, it was always like, I don't know. It's just a weird discovery, Alright, I'm just gonna go ahead and 1, 2. Okay. I'm gonna go ahead and do that 2 more times. 1, 2. Alright, 1 more time. 1, 2. Okay, your reflex is pretty good in that knee. It's pretty quick. 1, 2. Okay. 1, 2. Alright, and then 1 more time. 1, 2. Your reflex is actually very great compared to the people that come in here. You have a great reflex. Yes, you do indeed. Alright, next I'm going to take your blood pressure. I just have this cuff right here. I'm going to wrap around your arm. Go ahead and give me your arm. Just relax. Do you have a preferred arm? Either one? Okay. Alright, I'm just going to go ahead and wrap this around. So I'm just going to wrap that around. Okay, and you're going to feel a little pressure around your arm. If it gets too painful, let me know. It really shouldn't, but some people tend to be a bit sensitive to it, to the pressure. But I can assure you, it's not gonna decapitate your arm. I've done this to over 1,000 patients, and only one of them said it hurts really bad. But that was also a 9-year-old, so you know how they can be. All right. Alright, here we go. Alright, not bad, not bad. Your blood pressure is pretty good, nothing to worry about. It's slightly high, but that's normal, especially since you mentioned you drank caffeine this morning. That very well can cause a high blood pressure, which is nothing to be worried about, unless it were to get too high, then you would worry. But there's nothing to really worry about in that area. I'm gonna do a little hearing test. We did talk about your, ears being a little wax built up, Yes, we did. So I find it good to check on those, just kind of make sure that everything is alright. Just gonna go ahead and get that. Alright, I'm just gonna go ahead and I'm gonna tap this on here, and I want you to tell me if you can hear it. I'm gonna do your right ear first. Alright. Did you hear that? Okay, I'm gonna do it a little bit farther away. Okay, did you hear that? Okay. It's starting to get a little more dull. Alright. Okay, good, good. Okay, other ear. Okay. Okay, good. You have overall pretty good hearing. It's kind of hard to tell how good someone can really hear something, because obviously I'm not them, but if you were honest, then your hearing is very great. Alright, let me just get this over here. I'm gonna go ahead and just kind of check your eyes again. Yeah, your eye is kind of like twitching a little bit, which, if you don't know the exact amount of caffeine that you've had today, I'm just gonna go out on a limb and say it's too much for you to handle, which that's not a bad thing. That doesn't mean you're weak or anything like that, but too much caffeine can cause your eyelids to twitch, your under eye hair, and although caffeine is great, trust me, I love it. Can't go a day without coffee in the morning. But it is very important to stick to the limits that we feel are right for ourselves. I'm just gonna go ahead and check. Just kind of like look straight at my nose. Okay, I'm just gonna continue to look at my nose. Okay, I'm gonna do your other eye, even though it's not twitching. I just want to look at my nose. Okay. They seem fine. It seems to be just caffeine. Sometimes underlying problems can cause your eyes to twitch, and I always just kind of like to make sure, just kind of double check that everything is still fine, which it is. You have nothing to worry about. But I think I'm gonna go ahead and say we're pretty much all set. You did great today. Yes, you did. Some people freak out over the fact that a doctor is giving them a checkup, an exam, and sometimes it can be scary and just feels like too much, which I get that. I didn't love going to doctors as kids. It was always just kind of like awkward, weird. Yeah, and not every doctor puts on a smile, so it's just hard to kind of stop yourself from feeling intimidated a little bit or scared, or everyone feels differently about different things. But you really did great. You did great. Things seem fine. Like I said, maybe cut down on the caffeine a little bit. Maybe stick to, if you were gonna drink coffee, don't drink energy drinks. Vice versa, if you're gonna drink an energy drink, don't drink coffee. Pick one, choose one, stick with one. Coffee, if you're gonna drink it, don't go over 2 cups. 2 cups is fine. I think that's where your limit might be. But also, I could be wrong. Double check with yourself. You know yourself better than anyone does. So listen to your body and make sure things are all right. If you still have that eye twitch and you feel jittery after a second cup of coffee, only stick to one. Really only stick to one, that's my advice. And also make sure to kind of get your ears checked up. I can print you out some papers. Once you head out, I'll bring those out, so don't run away yet. But you'll go to the front counter, get checked out and everything, and I'll bring those papers right to you. But it is important to take care of your ears, kind of clear that wax out. Not a lot of people really ever think about that, but it is a very important thing to think about. So that is my suggestion. And don't worry, you're not weird for having excess wax buildup. I had a client, or a patient, not client. I used to work in retail, so yeah, I've had a patient come in and they were crying, although it was a 16-year-old girl. She was crying. She was like, "Am I weird for this?" And it broke my heart. She was so sweet. I just don't want you to, be self-conscious about it, because everyone goes through it at least once in their life. So, yeah, if you want, you can head down the hall, get checked out, go to the front counter, which that can take some time. I'm sorry about that. We're pretty busy today. It happens, but I will go ahead and print those papers out and run them to you. Alright, thank you so much for coming in. Yeah, it was nice seeing you. Alright, bye.